Morning, everyone. Before we get started, I'd like to thank Jay, and we have Danielle here with us this morning. Thank you for interpreting. As you all know, we are seeing a significant surge in COVID-19 cases in Hamilton County. Cases now stand at 5,010 positive results, 703 hospitalizations, and the death rate is 198. As always, I'm going to give you the change numbers. Jay hates this part. Sorry about the change numbers, because I want to show trends here, and we've got a graphic up that will illuminate what I'm talking about. So as always, I refer to it as the delta. It's really just the difference from week to week, the increase or the decrease. It's always an increase from week to week. So it's the change rate that we're seeing. So I'm going to plod through week upon week upon week to illuminate what this chart is showing us. So a few weeks ago, the change from week to week was 166, and this is in positive cases. Okay, so 166, 177, 398, 782. We're now at 912. Those are just the change rates from week to week. So it's dramatically increasing as the chart indicates. The folks that are being hospitalized, hospitalization rates, we were starting at 84, this is the same time frame, starting at 84, down to 46, down to 33, and then we started to see a spike in the positive test cases, and so lagging indicator here, we're up to 37, and now we're at 36, knowing that that number is likely to change and go up. So again, we're seeing this uptick in hospitalizations. The death rate, same period of time, 21 to 17 to 8 to 7, lagging indicator, we've now popped up to 10. So as you can see, and the chart illuminates it, we are seeing many more positive cases in Hamilton County. We are seeing now an uptick in hospitalizations and ICU visits, and we're also now seeing an uptick in the death rates. It was predictable, and now the data is showing us that that indeed is what's happening here in Hamilton County. So we've been conducting these briefings for over 3 months, and as I read the numbers, my heart just sinks. The numbers don't lie. And the numbers tell us that we are in dangerous territory. Hospitalizations are rising across the Cincinnati region. The number of COVID-19 patients in Hamilton County's hospitals has doubled from a low of 65 people on June 11th to more than 130 people this weekend. The Health Collaborative's dashboard shows that the region's hospital and ICU beds are just under 80% occupancy on Sunday. So there's room for more patients, but not the surplus of space that existed in early May as the pandemic started to ease. We're still okay, but we are definitely trending in the wrong direction. In addition, more young people are ending up in the hospital with COVID-19. People under 40 accounted for 11% of Hamilton County hospitalized cases in March and April. But that rose to 19% in May and stands at 37.4% so far in June. I want to talk about this for just 1 second, because I think what we know is that younger people generally, and Greg can elaborate on this, do better when infected with COVID-19, as opposed to our very elderly population who often have underlying issues that make them more vulnerable. However, what we also know is that now we're seeing more cases of these young people being hospitalized, and because people are getting sick, there are issues that are long-term issues for a person that gets COVID-19. I talked with Dr. Lofgren at UC Health a couple days ago about this, and he told me that people have long-term respiratory issues in some cases, no matter what age they are, when they get COVID-19. So I want to remind people that some people get it and are asymptomatic. Some people get it and don't possibly have, we don't know yet, long-term consequences. Some people are getting this, no matter what the age, and are likely to have long-term consequences because of what's happening to their system, particularly the respiratory system. And there can be long-term negative impacts there. So I just want to remind people that we all are potentially going to be negatively impacted long-term if we catch COVID-19, no matter what the age. There's no part of our population that's unimpacted, and there's no letting up if we want to stay safe and we want to stay open. I'm often asked whether or not businesses will close again. As you know, I don't have the authority to close businesses. However, my answer is always the same. The question is not whether businesses will close again. The question is, how can we all work together to keep them open? And we know what to do. We need to redouble our efforts to socially distance or safely distance. We have to remember to wash our hands frequently. And above all, we need to wear masks. Wearing masks is not just about protecting ourselves, but about protecting those around us. I want to anecdotally tell you that I've been asked, and I too want to be educated on how this virus is spreading in the community. And I know Greg Kesterman has been asked a million times, how is it spreading from one person to the other? Anecdotally, I contacted a couple contact tracers. These are the folks that are making sure that those that have been infected are isolating themselves and then reaching out to those that they've been in contact with. Anecdotally, here are a couple of stories of how this virus has spread. In one case, there was a baby shower, and all the folks in the room were sitting near one another, unmasked, and they were passing the gifts around. One person in that group was infected with COVID-19, and now many in that group are infected with COVID-19. There's another story about a surprise birthday party for someone in our community. Lots of people got together. Again, same thing, they weren't distanced from one another, they weren't wearing masks. Many of them got infected, and one of the older members of that group is now in the hospital. This is and it's also other things, and we've talked about these other things. But anecdotally, this is what we're hearing. And so it gives me the idea that people don't view those settings as congregate settings, but they are congregate settings, right? These are people that are not typically with one another, and they're close to one another, and they don't view it as, a public gathering. It's a private gathering, but it's still a congregate setting, and people are still at risk when you're in that setting. So you need to continue to practice safe distancing and wear a mask. So testing is available throughout the county. It has been available throughout the county, but we now have some pop-up sites in the hotspot zip codes that have been identified, both our local health commissioner and by the governor. You can visit HCPH, it's the public health's website, to find a map of all available testing sites. If you click on those locations, it's on the screen right now, it'll give you details about the hours, the days, and what you need to do before you go get tested. Call before you go. And also we've got these pop-up sites that are operating. Greg's going to talk more about that, especially right now in the Forest Park area, which is one of the hot spots in Hamilton County. So I went and got tested a couple days ago. It was the first day of the pop-up testing. I don't have the results yet back, by the way. They said 1 to 2 days, so hopefully I'll get a call today that I'm negative. But there were thousands of people going to get tested. That's the good news. There were lines of people on foot. There were lines of cars. So we are encouraging people to get testing. Please be patient. The logistics are challenging. We're partnering with EMA to work on those logistics, and local partners. In Forest Park, the chief of police was there, the chief of fire was there, the mayor was there. And so thank you to our local partners and all the folks that have been willing to host these testing sites in Forest Park. So Greg will elaborate on that, but we definitely want people to get tested. So we know what we're dealing with, basically, in this community. So this morning, as always, Greg KESTERMAN, Interim Commissioner of Public Health for Hamilton County, is with us, and he's going to talk to us about numbers and the latest trends. We also have Judge KUBICKI with us. Judge KUBICKI is the presiding judge of the Court of Common Pleas. He's going to talk about the steps the courts are taking to keep people safe as the courthouse resumes jury trials. So we're going to go to Greg first for the numbers.
Thank you, Commissioner Dreihaus, and good morning. I want to real quick just echo what Commissioner Dreihaus just shared with some stories from contact tracers. You know, in all three of the stories, what I hear is people letting their guard down. These are not groups of people coming together to protest. These are families saying enough's enough and I want to get back together with family or close friends. Right now is really an important time to make sure that we're not letting our guard down. We're protecting our families. We can still get together, we can do so safely, but now's not the time to let our guard down. I always like to follow up on the numbers that Commissioner Dreihaus shares with regards to those recovered within our jurisdiction. So that's outside of the city of Cincinnati, Norwood, and Springdale. In our jurisdiction, we have 2,672 cases of COVID-19, of which 873 have recovered. So I'll share, I've been sharing a lot about the reproductive number. I'll start with that slide. So just very briefly, if a reproductive number is above 1, then we continue to see an outbreak grow. When a reproductive number falls below 1, things start to shrink, and it's a good sign for the community. As I've shared for the last several weeks, this is just one indicator as we work through COVID-19. I am happy to see that today it is at 1.12. For reference, last week when I was here, the R value was 1.45, so it has dropped, which is a good thing. On the next slide, we continue to see, as Commissioner Dreihaus just highlighted, we continue to see cases rise here throughout Hamilton County. For the longest time, my team was managing between 20 and 30 COVID-19 cases and doing the contact tracing work on those cases. We are now closer to 70 to 90 cases per day, so a significant increase in the workload for my team. They are still continuing to call each case and do that important work of contact tracing and make sure we're able to get to each individual. We know that as we increase testing in targeted locations, we're also going to anticipate to see some increase in numbers from this activity. This is not surprising that we're finding more cases as we are greatly increasing the testing. We're also seeing, as Commissioner Dreihaus just highlighted, more young people being tested. I think it's important to note that a month ago, these individuals did not have access to testing. You may recall that testing was very much reserved for the sickest individuals and those individuals that we believe to be at highest risk. We continue to see the numbers of hospitalizations increase here in the region. By mid-June, we were about 60 cases hospitalized. We now have 150 patients hospitalized approximately. Similarly, with the intensive care units, we were about 20 cases in mid-June, and we're now closer to 50 patients hospitalized. That is regional data, but realize a lot of the hospital capacity does sit within Hamilton County. Moving on to talk a little bit more about testing, as Commissioner Dreihaus has mentioned, we've been doing a lot of work here in partnership with the Ohio National Guard, the county administration, and commissioners to increase testing opportunities here within Hamilton County. Testing is a valuable tool for slowing down the spread of COVID-19. We know when someone has a positive test, we are then able to quickly do contact tracing on that individual and get them out of the community so that we can slow the spread of COVID-19. We are in the middle of 2 weeks of intensive testing in Hamilton County being provided by the Ohio National Guard, our local communities and community leaders and public health. We have testing sites scheduled throughout the area, particularly in 45231 and 45240. Testing is conducted at no cost. If you have insurance, they will bill your insurance, and my understanding is your insurance will not bill you for a copay. In addition, if you do not have insurance, there is still no charge. They will not require a payment there at the site. So it is no cost testing, which is a great opportunity for everyone to go get tested. The lines have been long. They have ranged from anywhere from an hour and a half to 2.5 hours, depending on when you go to get tested. So please be patient, but we are excited to continue to offer this, and hopefully as we continue to offer this in the community, we see some decrease in the lines. On the slide there, these are taken up in Forest Park at the testing site. These are some examples of how it looked. In the very top left picture, you see a parking lot full of cars. Every car in that parking lot is waiting in line to get tested. So significant number of people showed up to be tested. There were 741 individuals that were tested on Monday at the Waycross location. And then yesterday at the Word of Deliverance Ministries for the World, we saw 900 tests completed. I'd like to thank Mr. Bobby Hilton for hosting public health and your community. I'd also like to send a huge thank you to the City of Forest Park Fire, Forest Park Police Department for ensuring that these testing events were successful for your community. These were long, hot events. It was very hot for all of our workers out there. Many of the National Guard were wearing gowns all day long, and I'm certain it was an uncomfortable day, but it really had a great impact for those residents. It was fantastic to hear residents talking with police and engaging each other and learning more about what they were up to and why they were concerned to get testing, so we appreciate those stories as well. As we continue to get Ohio back open, we must continue to keep our focus. I can't reiterate this enough. It's really important to continue to not let our guard down, as the pandemic has not only caused significant health problems, but also it's caused significant distress and hardship on some of the most vulnerable members of our society. When families are without work, it creates stress and issues. Not only has this driven people to make decisions as to how they can pay for things and food for their family, but it also sometimes keeps people from accessing critical care. It's important if you need care from a medical provider, that is still safe. So feel free to go back to your medical providers or seek dental care if you need it. It's important to do so. We also want to, as we open things back up, remember if we do this correctly, if we're wearing masks and we're taking precautions, we are keeping our businesses safe. When people feel safe to go to businesses, they're more likely to go out and help drive the economy. So I think they're very much tied hand in hand. We need to continue to work as a team. So in closing, I just continue to ask each of us when we go out, wear a mask, continue to be sensitive as you're around other people to allow for social distancing. Don't forget the importance of basic germ hygiene, which is washing your hands. If you can't wash your hands, use hand sanitizer. Cover your cough if you have to cough. And most importantly, keep sick at home. Even if you get a negative test result in a week, if you're feeling sick, you need to stay home because you then might have COVID-19. And lastly, most of all, be kind to one another as we work through this pandemic. Thank you.
Thank you, Greg. Next, we're going to hear from Judge KUBICKI. As mentioned, we are starting up jury trials over across the street at the courthouse, and Judge KUBICKI is going to talk about the safety protocol that will be in place as we start to reopen over at the courthouse.
Thank you, Commissioner Dreihaus, and I appreciate the idea that you've allowed us to use this facility. Again, my name is Judge Charles KUBICKI. I'm the presiding judge of the Hamilton County Court of Common Pleas. As presiding judge, I want to make it clear to you that we have kept the justice system running since day one of the stay-at-home order. We were never closed, and justice was still being administered in the People's Courthouse. We have put immense safety measures in place to ensure that every citizen that comes through the courthouse will be safe. Whether you're working or whether you're at a hearing or a witness, we ask that you wear a facial covering or mask, continue to keep a safe distance of 6 feet, and use the hand sanitizers that are made available throughout the courthouse. The courthouse will continue to have frequent sanitizing of common areas. Any and all persons will continue to be checked upon entrance for any potential signs of the virus, just like when you go to your doctor's office. Based on the early proactive measures that we have taken at the courthouse, we've been very fortunate that we have not seen a COVID virus outbreak at the courthouse or at the jail. On July 13th, we will resume jury trials. We've been able to come up with creative ideas that I think will ensure the safety of the jury, the public at large, and allow people to have their day in court. For jury trials or jury selections, we have dedicated rooms where each member of the jury is separated by plexiglass, and each member of the jury will be continued to require to wear facial coverings. The attorneys will be in closed areas for their opening, questioning, and closing. These measures have been approved by the interim director, and I appreciate the timeliness of his response. As I've said before, no one should have to choose between health and going to court. That is why we're confident with the new system we have put in place. We are also using technology in the courthouse, changing the way we do the people's business. We've incorporated Zoom hearings and have allocated resources for courtrooms. We are doing this not only to help fight the coronavirus, but to ensure people have a right to a speedy trial, victims get their justice, and we continue to uphold the Constitution. In order to continue with the fair and equitable administration of justice, we need your help. Trial by jury is one of the most valuable rights that we as citizens possess. Jury service is one of the most valuable duties that we as citizens can perform. In order to continue to serve the people of Hamilton County and the state of Ohio, we are asking for your help. If called upon to serve as a juror, please consider serving in order to help us continue to administer fair and equitable administration of justice for all. Obviously, if you have a health concern, you can go ahead and notify the court or the particular courtroom or whatever the appropriate party is to let them know of your health concerns. That's of paramount importance. Information about courthouse operations will be posted on our website and updated from time to time. That website is hamiltoncountyclerks.org. I want to thank you all for your time and your consideration.
Okay, before we get to questions, I just want to illuminate some of the sites for testing, these pop-up sites that Greg referred to in our community. So I'm going to give just a little bit of detail here so that people know where the access to testing is in their community. So today, the location is Forest Chapel United Methodist Church on West Sharon Road, up in the Forest Park area. Tomorrow is the Walmart on Smiley Road, also in the Forest Park area. On Monday, there will be testing at the North College Hill Lifespring Church on Galbraith. On Tuesday, they'll be in Delhi at the former Remke on Delhi Pike. And on Wednesday, they'll be at the Coleraine Public Works Facility on Springdale Road. Greg, am I right that they're all from 1 to 7? That's correct. They're all from 1 to 7. Personal experience tells me get there early if you want to get tested, because they do get very crowded. We are celebrating that people want to get tested, but if you're in that line, it can be a little challenging. And the day I was out there, it was a hot day. It took about 2 hours, but I got to tell you, it's worth the peace of mind. It really is. So we're excited about having this pop-up testing. And Greg did mention this. The county has, as we've talked about, put out an RFP for $19 million worth of testing in this community. That will kind of dovetail as these pop-ups cease. That testing will start to ramp up, and so they will complement one another. More to come on that. We're not quite finished wrapping up that contract, but we're very close. All right. I think that's it from our side. I think we're ready for questions.
Thank you, Commissioner. Up first, Local 12's Jenna Cisneros has a question for either you, Commissioner, or Greg.
Well, I feel like I should just walk away from the microphone, but I'll stay for a moment to see. Good morning.
Jenna, it looks like you might need to unmute yourself.
Am I unmuted now?
Whoa, I gotcha.
Oh, sorry. Is this too loud? Can I go?
We're good. We're good.
Okay. Hi, Commissioner. Sorry about that.
Good morning.
Given the uptick in county numbers, why is the county not yet requiring people to wear masks or putting additional restrictions in place for businesses and gatherings?
Well, the short answer to that is that the county commissioners don't have the authority to mandate masks. And Greg, I think, can illuminate on this a little bit. As you know, we've been following the guidance from the governor and the health commissioner at the state level as they have worked to try to keep the community safe. So I'm going to let Greg talk just a little bit about where that authority lies. That said, does it take a mandate to get people to wear masks? I mean, we know what we know. In the very beginning of this, we were all masking up, we were staying away from each other, we were staying home, and we flattened the curve. We didn't have to mandate that. People did it because they knew what they needed to do. We're asking people to exhibit that same behavior now so that we kind of work towards the same result. But let me have Greg illuminate.
Thank you for the question. So a general health district cannot make a rule for masking here at the county level. We would look to the state of Ohio to make a rule in our jurisdiction. A city potentially working with their legal team or their prosecutor could potentially create pockets of masking requirements, meaning a small city that I serve, for example, Forest Park, could potentially consider doing something along those lines. Although really the statewide approach is best so that messaging doesn't get confused. It would be really hard in a county where there are 49 political subdivisions or cities, townships, and villages to follow which jurisdiction had a requirement for masking. So we are really encouraging, if we're going to do it, it would be helpful to do it statewide so that people aren't getting in trouble in small pockets and small communities for not wearing their masks. The other thing I really want to keep emphasizing, you know, I do see some trends, and this is not scientific, but when I was at the grocery this past weekend, after we really started messaging that we're trending up, overall compliance of masking went up. You know, I think at one point I referenced that only 2 out of 10 people were wearing masks. That means that 8 out of 10 people weren't helping slow the spread of the virus. As we have more people start to wear masks, the better off we are at controlling that curve and reducing the number of cases here in the county.
So real quick, does the authority lie within the governor's power there and not, like, the county can't do that at all to require the mask?
At a county-wide level, it would have to come from the state of Ohio.
Okay, thank you.
Next up, we have Jay Hanselman with WVXU News for you, Greg.
Okay.
I'll try to keep these brief. You hit on some of this when you were talking about the Commissioner Dreihaus was talking about the baby shower and the surprise birthday party. Can you put a percentage of, through your contact tracing of these new cases, how many are tied to those social events? I mean, is it 50%? Is it more than 50%?
I do not have an exact number. In not all instances do we always find out the cause of COVID-19, but there are instances where we do see outbreaks happen as a result of specific events. Generally speaking, I would say it happens more often than not, but I don't have a number I can provide.
With the social gatherings, this is going to be a busy holiday weekend. What would your message be to people, and how concerned are you about this being a busy holiday weekend when folks typically get together?
You know, it really ties back to what we were just talking about. When we come together as a community and we are tired of COVID-19 and we decide to invite the family over, COVID-19 still exists. And if the young kids have been out playing with a bunch of other young kids, the chances that they have become sick from COVID-19 increases. If grandma and grandpa have now left down their guard, the chances of grandma and grandpa getting sick from their grandchildren certainly increases. And so the risk is even just as high today as it was at the beginning of the pandemic. I really just want to encourage, if you're coming together as a family, which is a healthy thing to do, Don't be afraid to social distance. Don't be afraid if you're going to be inside to wear your masks, and continue to do those things. You know, embracing through hugs is important, but if it means making grandma sick, it might be time to just consider going back to where we were a month and a half ago, where we said hi from a few feet apart and we weren't allowing the germs to go from person to person.
And if my quick math was right, I think I heard, it sounds like there were more than 1,600 people that were tested Monday and yesterday in Forest Park. Are you tracking how many of those are asymptomatic or are being tested that they're positive and they've exhibited no symptoms?
In the region, they are monitoring the positivity rate. In general, it has been between, I want to say, 5 and 9%. I believe Hamilton County tends to be slightly higher on the percentage. I don't know if I'll have specific data to these specific sites. It'll be probably more clumped together with all the testing that's happening in the county.
Okay. And then just a couple of quick questions, if I could, for the judge.
Absolutely.
Good morning.
Good morning.
You spoke about the issue that if a juror had concerns about health issues that perhaps they wouldn't necessarily have to serve on a jury. What about witnesses that are concerned about offering testimony? Is there a way for them to testify remotely?
Yeah, in answer to your question, the distinction we make, we're interested in the administration of justice, but we recognize the health concerns. Health concerns are going to trump everything. So whether you're a witness, whether you're a party, whether you're an attorney, or whether you're a prospective juror, if you've got health concerns, we're going to allow that to go ahead and carry the day, and that may derail or bump whatever else is going to go ahead and take place. But it doesn't just apply to witnesses. As the Chief Justice of the Ohio Supreme Court pointed out, what we have to take into consideration is our responsibilities to administer justice, but we also have to remember that we are not a retail business where somebody's elected to go ahead and go shopping there. In this situation, we don't want to be in a situation where we make somebody choose between their health and violating a court order, so health takes precedent.
Hey, can you just speak about maybe the backlog of how many trials are pending and what that number is?
Well, unfortunately, we stopped doing trials about the time the virus broke out, so I think we got our last trials completed on a lot of times it takes your day in court at trial to decide whether or not you're going to resolve it or not. I know that the grand jury's caught up on the backlog of cases because there was a little status of limbo where grand jurors, we couldn't field a grand jury and there was a little bit of a lag. I understand that's now been caught up. We do have a backlog, however, of cases, and a lot of them are starting to be set for trial in July, and I expect that going forward it'll be set further for trial. The goal is to have 3 courtrooms up and running with the safety measures I talked about, 2 of which the priority would go to common pleas court, 1 of which the priority would go to municipal court to help alleviate that backlog.
All right, thank you.
Thank you.
Our next question comes from Chris Wederick with the Business Courier.
Oh, no one's up there. All right, Chris, good morning.
Good morning. Can you hear me?
We can.
Great. So question, I think first for Greg, and then the next one, Denise, is probably for both of you. Greg, I was wondering what's the latest nationally about asymptomatic spread and whether the tests that people are taking, will they reveal if you have the virus if you are asymptomatic?
There is still a little bit of mixed messaging on this, but generally speaking, these tests, they have a positivity rate, and there are different tests that you can take, and the accuracy of that test is based on the positivity rate or the accuracy of the test. So it will show asymptomatic individuals and as well as pre-symptomatic individuals often. Sometimes though, if I got exposed to COVID-19 today and I decided, man, I want to go get tested because I know I was around someone, today is too soon to go get tested because I haven't developed enough of the virus in my body to be detected. So there is a need to delay from that initial exposure so that you can start to be sick and show up in a test.
So like a day or a couple of days, how long should they wait?
Generally speaking, a few days would be appropriate. And if you're ultimately decided that you're a close contact, even though you get a test in a few days, you would still be required to isolate yourself for the entire 14-day period. It might just give you a little bit of sense of security, but you still are required to isolate.
Okay, great. And then a question probably you can address, and maybe Denise as well. You know, of course, Twitter is not real life, but I'm already seeing people saying, well, is that hospitalization number, does that really indicate a spike? You know, isn't this really just more people getting tested and showing that in the results?
Thanks for that question. So I can tell you from day one, I've been clearly saying as we increase testing, we will see increased cases. The two numbers, actually the three indicators that will not lie as to how much COVID-19 is in the community are hospitalizations, intensive care unit admissions, and ultimately deaths. Those numbers makes no difference if you get tested or not. If we see an increase, it's because there's more spread of COVID-19 in the community with those.
Okay. Denise, I don't know if you want to address that at all, or maybe Greg handled that one.
Well, yeah, so I understand this question, and I too, originally, you know, when we talked about more positive cases in the county, we've increased testing. So of course we're going to see more positive cases in the county. But by all accounts, the volume of increased cases of positives cannot be all attributed to increased testing. And beyond that, let's forget about the chart and the trends. The hospitalization rate, remember a few weeks ago, it's like 5 weeks ago, it was at 84. So we were on the decline, very steady, and you can see it in the chart, steadily moving down. And right now, we're moving in the opposite direction, and it's a lagging indicator. And so all the experts are saying, and these are all the public health experts, are saying that trend is what's troubling. It is a small increase right now, but we're moving in the wrong direction. And so we don't know what these lagging indicators are going to say, you know, in a few days, in a few weeks. And so when you talk to the health collaborative, when you talk to the hospital administrators and the folks that are on the ground every day, they're really concerned about these numbers. And I take my cues, by the way, from folks that are doing this every day, and the public health commissioner. We're not making this stuff up. I mean, this isn't just, oh, I see numbers, we are relying on public health experts to inform these numbers for us. And that's exactly what they're doing. Let's not forget about the death number too. 21, 17, 8, 7, you can see the trend. Now we're up to 10. We are moving in the wrong direction. That's the problem. It's the trend that we're troubled about, because that can take off in the wrong direction. So I hope that answers the question. I think we're all a little quizzical, I think, not skeptical so much as just, wait a minute, what are we seeing and why are we seeing it? We have some experts telling us what we're seeing and why we're seeing it.
All right, thank you very much, I appreciate it.
Commissioner John London is up next from WLWT Channel 5.
Good morning, John.
Hi, Denise. I have one question for you and then one question for Greg. But for you, what is the significance that you see of the Centers for Disease Control visit this afternoon? What do you want to communicate to the feds, and what do you hope will come of this meeting?
Well, I do believe that we have always been working in partnership with all levels of government, federal government, state government, City of Cincinnati, Hamilton County. We are working in partnership, as we should, as you all expect us to, right? We are sharing resources, we are sharing expertise, we're sharing logistics, and so my expectation for today is, as the federal government comes to Hamilton County to have a conversation, it will be one of what are we seeing on the ground to inform them in decisions they're making, and we will be hoping that they in turn say, we see that you guys have an increase here, how can we help? You know, what do they have to bring to the table by way of especially logistics, testing capacity, some of the things that we are doing locally. Thank goodness we've got those dollars from the federal government through the CARES Act to allow us to do that. I will be thanking them, by the way, for those resources. But how can we be working together to address what we see is happening here? while on this topic, by the way, the hotspot pop-up locations are being staffed by the National Guard. So that is a state partnership. County and these local jurisdictions are offering logistic support, traffic control, helping get the paperwork filled out for people in line. But the Ohio National Guard are the ones staffing those tents, and so we are very grateful for the partnership at the state level. Hope to bring more partnership then to the federal level down to Hamilton County.
But do you see something specific coming out of this meeting that would relate to what should be done in Hamilton County specifically?
No, I don't have that expectation. I can't speak for the federal government and the CDC, but I do think it is a meeting so that they can learn and listen to what we are experiencing here in Hamilton County, and then we will talk about partnership as to how to address the need.
Thanks, Denise. I just had one question for Greg, and Greg,
Hi, John.
I know you know that there's now a fifth Metro driver who has tested positive for COVID-19. So our folks are wondering, do you know the source of that driver getting it, or any of the drivers getting it? And what can you tell us about contact tracing for passengers and other drivers, et cetera?
So I'm actually, I'm not familiar with that specific case, but I can tell you that individuals in a whole variety of professions are getting COVID-19. Can we definitively say that individual got sick as part of their job? No. Is it possible? Yes. So as people are opening back up and going out and doing more and having family gatherings and spending more time in bars and restaurants without protecting themselves when they're in these locations, there are often many opportunities for contracting COVID-19.
Thank you.
Yep.
We appreciate it.
Okay, our next question comes from Courtney Francisco with WCPO Channel 9.
Hey, I wanted to ask about testing capacity here because we have so much more testing going on, and we're hearing nationally that the testing supply chain is stretched to the limit already. So talk to me about what that looks like here locally.
So one of our main laboratories doing laboratory testing here is at the University of Cincinnati, and I can tell you in talking with their laboratory team that they are not yet at capacity. They still have supplies and they still have volume that they can increase the number of tests performed per day. Statewide, I am continuing to see new locations pop up, including here in Hamilton County. So at this moment in time, I think we're doing very well with testing, and we look forward to increasing testing, as Commissioner Dreihaus said, with the contribution of $19 million to this effort.
And any concern about, how long it takes them to get the testing back? Because right now, because of the shortage in other parts of the U.S., their hospitals are getting them back in one day, but regular folks, it's taking 3 to 5.
So we're still seeing most individuals get tested with results back in 1 to 2 days. Obviously, the sooner I can take someone who has COVID-19 and begin the isolation work and the contact tracing work on them, the more impactful it will be. But ultimately, every case that we're able to isolate, even if it's 1 day longer, is making an impact. So all of these efforts coming together are important.
Conclude our questions from reporters.
Okay, just a couple things as we wrap up. Again, big shout out to the folks in Forest Park who have helped with these pop-up sites. It was a very quick turnaround. And so thanks to Mayor Johnson, Fire Chief Jones, Police Chief Arns, Pastor Bobby Hilton for hosting one of the sites. We are very grateful. And in fact, some of the folks from Delhi were in Forest Park so that they could better understand how this rolls out and what that might look like in Delhi next week. So thank you to all the local partners. We're still doing these jurisdiction calls once a week, and the local partners have been critical to this effort. And lastly, I want to say, and one of you mentioned it, we've got a holiday weekend coming up with the 4th of July. We are all looking forward to celebrating the holiday. But we have to do it safely to protect ourselves and the folks that we will be with. And so we've talked a lot and emphasized how people letting their guard down or relaxing the mask wearing has caused a problem in this community and an uptick in positive cases. There also, though, are many people that continue to wear the mask, that are staying distance from one another. I, was out at a park the other day, and people were intentionally removing from one another. So when I'm on my walk in the morning, we're all like, if you see somebody coming up on the sidewalk, you move to the street. We're doing this, and so many are doing the right thing and are taking this seriously. I just want to be thankful to the community for that effort. Some of the businesses too, those that are requiring masks in the businesses, and it's challenging because some folks don't want to wear a mask when they go to the hardware store, they go to the grocery store. However, people are doing it, right? We're all trying to do the right thing. So I do want to do a big shout out to those that have been wearing a mask for 3 months now. I mean, I personally hate wearing a mask. It's especially when it's hot out, and it's large and it's sweaty, and you know what though? We're trying to protect each other. So we're doing it. So thank you for doing your part. We need to keep it up. And I do hope that everybody has a very happy and safe holiday weekend. Thank you. Do we have?
Yeah,
Oh, no.
late one.
There's somebody's trying to sneak in with a question.
I've
Depends
got
on who
one
it is,
question.
Bridget. Who do we
I'm
have?
sorry, have you heard about Kroger announcing today that it's going to provide, that FDA has granted emergency use authorization for at-home test kits? Have you heard anything?
I haven't heard anything about that. Sorry.
Okay.
All right. With that, Jay, are we finished? Jay says we're finished. All right.